Hi, I'm Tatum, and today we're exploring the science of sleep. Because one thing I do know is that when we have a bad night's sleep, it can make everything else that we're going through even worse, physically, mentally, emotionally. And so I'm really glad to be talking about this subject today with two brilliant guests. We've got Andrew Davies, a professor in palliative medicine at Trinity Hospital, University in Dublin. And he's done research on really interesting things that can really affect our lives, such as side effects and constipation, whole other thing, but really those things that make a difference to our lives, like sleep does. And Shauna Munir is an advanced nurse specialist undertaking her PhD researching ways for cancer patients to get better sleep without drugs. Welcome both of you to the podcast. So let's get to it and dive into bed. Andrew, what is one of the most surprising things that a good night's sleep can give us?
I think we all have experienced bad night's sleeps and last night. And your performance the next day is just not as good. I think the people we see have ongoing problems over weeks, months, sometimes years. And that has huge impact on their quality of life. So I think it's more the effect of not having a good night's sleep that is the problem. It can have serious long-term health effects, and particularly for the sort of patients that Shauna and I look after, which are mainly patients with advanced cancer, it adds to the burden of their disease. And luckily, there are things that we can do that can help with that problem and therefore improve their quality of life.
And I think that's the thing, is that in our culture, we don't really recognize that deficit that comes with chronic lack of sleep. Like, we tend to use the word tired, but it's so far beyond that. Like, when you think of tiredness, if we're driving, is really dangerous. I don't think we really have a language to kind of adequately relay the effects of it. But I also think that out of everything else that you're dealing with, it can be really hard to then go to the doctors or to someone and go, and I can't sleep. You know, because you've got these really big things. You've got pain, you've got medication, treatment, you know, that actually this thing I think often gets overlooked. Is that something, Shauna, that you've seen?
Yeah, it definitely is. And I suppose, you know, when you're going into your oncology appointment or you're going in to see your GP, you're given maybe a 15-minute slot if you're lucky, and that can feel very rushed for patients. So I think that even, you know, if somebody has pain or they have other symptoms, oftentimes sleep gets put down at the bottom of the list and never discussed, unfortunately. So yeah, it seems to be a forgotten symptom, unfortunately.
But if there was anything that I'd want someone to take away from this conversation today, is that it is valuable. Like, you can bring it up. And, you know, like you were saying, Andrew, there are things that you can do to improve the likelihood of getting a better night's sleep. So yeah, addressing that, I think, is sometimes one of the biggest hurdles, because some people have been living with bad sleep for so long that it's just become a way of life. What is kind of the spectrum of sleep disruptions that you see, Andrew?
I mean, we see all sorts of things. I mean, from people having difficulty getting to sleep, so just lying there, unable to go to sleep, waking up multiple times during the night, waking up early in the morning, and not being able to get back to sleep, and a variety of sort of, you know, combinations of those things. We see people that have problems with vivid dreams and particularly nightmares because they're being woken up multiple times during the night. And then we see people complaining, and often this is how they present. They complain about fatigue or drowsiness because they haven't slept, and then the next day they don't have any energy. They're feeling sleepy because they haven't had a good night's sleep. So often people will not necessarily complain about the sleep as such, but complain about the complications. And if you're tired, you can't cope with all the other things. I mean, if you've got pain, you haven't had a good night's sleep, that makes it even more difficult to cope with the pain. So although, I mean, Shauna's right, sleep's what's called in the trade, you know, an orphan symptom. It's something that patients often don't bring up. It's things that healthcare professionals often don't ask about, but it has a huge impact. And for lots of patients, if it was out there in the open and healthcare professionals did something about it, well, actually the patients themselves or the people themselves can do quite a lot themselves to sort out the problem. And I think that would be, make a huge difference to lots of people's lives.
And what are some of the reasons that as a population group we're particularly vulnerable to not getting a good night's sleep? Shauna?
I think it's probably culturally glamorized, a thing of, I'll sleep when I'm dead attitude. So yeah, you can survive on 4 hours sleep, all of that. So I think that, as in the general population, is probably why it's become a bit of our culture.
Yeah. And having cancer, how does that sort of interplay with that kind of background noise already there around sleep and this underplaying of its value?
Yeah, well, I suppose it's in people with cancer, sleep disturbances are really common. So it's up to 3 times more prevalent in people with cancer than in that of the general population. There's multiple causes of it. So there's the symptoms of the cancer itself, which could be pain, nausea, vomiting, constipation, kind of a lot of various symptoms. Could be side effects of the treatment or the medications that they're on. The anxiety associated with the cancer itself, treatment, scans coming up, scanxiety, irregular routines, kind of hospital environments. We know that hospital environments do not lend themselves well to good sleep.
Yeah.
And then I suppose there's a bi-directional relationship. So poor sleep is going to worsen our fatigue and our mood, which in turn worsens our sleep. So it becomes a vicious cycle. So that's why it does become so important for us to assess people properly when they're having trouble sleeping, and to see what's actually causing it and treating the causative factors rather than, trying to put a plaster over a good wound, I guess. And then again, I suppose the earlier we manage it, the better the outcome.
Yeah. And one of the things, definitely for people within Shine is that hormonal dysregulation, because they're going through menopause so much earlier than they normally would. I know for me that was the big thing. As soon as I started to relax, I started to get this huge hot flush, which often meant that I would, when you feel yourself falling to sleep and there's that, like, you can feel the luxury, like a blanket that you're about to cuddle into. And as you're stretching out before it like slips away, and it would be replaced by this absolute panic that was a hot flush, but felt very much like a panic attack. And so I'd wake up furious and swearing quite often, which was not relaxing for anybody. And then it would happen again and again and again throughout the night. And that wasn't recognized by anybody. So I actually never got to sleep. I just was sort of irritating myself all night. Is that something that you've encountered as well? This kind of, also how we maybe respond to it, kind of accentuating it as well.
Yeah, I mean, we know that just having cancer, as Shauna said, is a risk factor. And so, the process of having the cancer, the changes that occur in your body, that can affect your sleep-wake cycle. And then you get into bad habits, and you stay in those bad habits unless you do something to break them. And as Shauna says, it's very complex because, you might start off with one reason for not sleeping and then develop a subsequent one. And a lot of the treatments that are used to manage cancer, not just the, things like chemotherapy and whatever, but even the drugs to manage symptoms, they can have an effect on your sleep as well. So for instance, lots of patients get put on steroids at various times during their treatment, corticosteroids. That can affect your sleep. As you've already alluded to, people on hormonal treatment, they often have disturbed sleep, So when we see people with disturbed sleep, they often have maybe 2 or 3 factors that have either precipitated or are perpetuating the sleep problems. And so part of the management is, as Shauna's already said, is to try and sort those out. I mean, all too often people have been in the past just given sleeping tablets, and they don't work very well, if at all, because they're not addressing the underlying problems.
So it really is kind of identifying the factors that are causing or preventing sleep. I know there have been studies connecting loneliness with bad sleep in younger people. And they did a study that it showed that people woke up multiple times during the night when they were more lonely. And it wasn't people that were necessarily socially isolated. It was the loneliness. So they could be around people but still feel lonely. And they were positing that one of the reasons that we might have these micro awakenings more often when we feel lonely is going back to kind of back in the day, being in a tribe was safety. And when you were outside of the tribe and when you were alone would have been dangerous. So your body wouldn't let you completely sleep when you felt alone. And I know that loneliness is often reported. I mean, it's one of the biggest things that we found in our studies with, people between 20 and 49 with cancer. Is that something, Shauna, that you've seen as well?
I mean, we did look at some of the studies around kind of sleep problems in people with advanced cancer specifically. And some of the studies that we came across did also say that sleep tended to be worse in younger people and in those who lived alone as well. So yeah, we did come across that when we looked at the literature.
Yeah.
But equally, what is very clear as well is that the people, carers, family members, your partner, often if the person's got a sleep problem, then their partner will also have a sleep problem.
Yes.
Because obviously if you're waking up multiple times at night, you will disturb your partner. And often a lot of the reasons why the person's developed a sleep problem, the carer has them as well. They're worried about the future. They're worried about their partner. So it's a difficult problem. You can't just treat the patient. You have to treat, the partner as well.
I'm so glad you brought that up. Yeah, because my girlfriend was not very happy with this swearing, huffing and puffing, throwing off the covers all night. And yeah, like the next day, it puts a whole strain on your relationship. And again, that's not to be underestimated. If somebody comes to you and definitely want to hear more about your research, after identifying some of these causes, what is your next thought process on maybe, something that someone can do that isn't taking drugs?
Well, I suppose if they come to me, it's again assessing them properly, seeing what is contributing to the sleep. So, for example, if somebody's waking up because they have a pain, like if they're waking up because there's a pain, there's no amount of medication, sleeping tablets, or other interventions, which I'll discuss in a second, that's going to help with that. So you need to, I suppose, look at what is actually causing it. Are they having difficulty going to sleep? And if it is, what's the reasons? Is it racing thoughts? Is it symptoms? What is it? And I suppose that probably lends it on nicely for me to plug my research. So my research looks at non-pharmacological management of sleep disturbances in people with advanced cancer. We're using 3 different non-pharmacological methods. So the first one is cognitive behavioral therapy for insomnia, which is a bit of a mouthful. That is a structured therapy that is used to identify thoughts, feelings, and behavior surrounding sleep, and then using strategies to challenge and reframe those thoughts, feelings, and behaviors. So each participant that comes onto the study gets access to an online platform, and on that platform there's basically 4 kind of sleep lessons, we call it, but it's all around cognitive behavioral therapy for insomnia and kind of guides them through that. And then the second element of it is bright white light therapy, which is another mouthful, but this is essentially the use of a really, really bright light box to be used within 30 minutes of waking up, for about 30 minutes. And I suppose the concept behind this is around resyncing our circadian rhythms, getting things kind of kick-started in the morning. And I suppose light boxes were originally brought out for the treatment of seasonal affective disorder. Yeah, but actually they I suppose they do work for that, clearly in the studies, but also they really help with sleep. And I suppose it's, again, looking at that bi-directional relationship. And then the final part of the study is an individualized activity plan. So it's literally just me sitting with the person, looking at what activities do they enjoy doing, or did they enjoy doing that maybe they've kind of lost along the way. And then I would check in with the person every week, I suppose, to see how they were engaging with each of the activities, or the interventions, if there was kind of any technical difficulties, if there was kind of any barriers, and I suppose like talking through them. So they received them 3 interventions over 6 weeks, and the week before and the week after they received these interventions, we conduct 3 questionnaires. So the questionnaires, one of them looks at our sleep quality, their sleep quality, one of them looks at their symptoms, and one of them looks at kind of symptoms and quality of life. And we look to see if there's been an improvement before and after. And then we're also using a wrist watch to measure sleep, and then a little device that we pop on their thigh to measure activity as well. So I suppose looking to see if there has been an improvement, if it's worthwhile at all before and after. And I suppose we've had all different ages, people from their all the way up to their 80s. We've had people with various cancer diagnoses and various backgrounds in life. And I suppose, as Andrew mentioned, and you know too well, about people's kind of partners or their caregivers experiencing a sleep problem often if patient or participant does. So while we weren't, I suppose, actively looking at the participants' partner's sleep, we weren't assessing that, but we did, I suppose, encourage engagement with the intervention, because I suppose they've a knock-on effect. So we might be improving the participants, but then what happens if we're not improving their partners? And some of the partners did, and reported that it did really, really help them. So yeah, the response was great.
Okay, so that's really exciting. So I have some questions. Did people choose which one, or did they do all 3?
They done all 3.
They did all 3 at the same time.
They didn't have a choice.
Well, they did have a choice, because we weren't following them right. I think the other thing is part of the CBTI, the cognitive behavioral therapy. A lot of that also involves sleep hygiene measures. So they're very simple, practical things people can do. And it's all about, getting ready for sleep, avoiding stress and bright lights before you go to bed. It's retraining your body, if you like, and your mind to the fact that it's nighttime, it's bedtime, you go to bed, you go to sleep. So there are lots of bits of advice that Shauna gives to the patients as well, about what to do in the evening before they go to sleep, as well as what to do in the morning.
I must admit, I've always been a little resistant to any sleep hygiene lists, just because I feel like there's something about feeling like you're being dirty for having your phone in your bed, or like you're doing something really wrong, and no one wants to be unhygienic, right? But there's something about whenever I see those that like, it just like makes me like want to not do them, like almost rebel because it comes under that banner. And I just didn't know, am I alone in that, or have you found that with other people?
I think it's a strange term, sleep hygiene. I'm not sure it's probably the most helpful term. I think the most important thing is actually getting up at the same time every morning. It's called sleep restriction. And it doesn't matter how bad a night you've had, you get up at the same time every morning.
And that sounds punishing, doesn't it?
It does. I mean, we have real issues, because Shauna and I both work, do some clinical at the hospice, and when we try and say, this patient, you've got to get them up at 8 o'clock in the morning, it's really difficult for the nurses, because the patient's had a bad night. But yeah, we're aiming for a improvement in the medium term. So a short period of a little bit of pain, taking away people's mobile phone last thing at night, or making them get up early in the morning.
I mean, that's cruel.
It is cruel. We're very cruel people. But I mean, the differences that Shauna has found in her study are very dramatic in terms of general improvement in their symptoms, improvement in their quality of life.
So if there was a way to frame this, because I'm wondering if there might be some people like me out there, that if we think of sleep hygiene as reframing it as things that you do to kind of get ready to make the environment sleep conducive, and that they're like kind of part of your sleep nourishment or something nice, sleep coziness. And I have heard about sleep restriction, but thinking about it as a way to avoid the jet lag of waking up at different times. So thinking of it more like a sleep consistency. Or, yeah, kind of like figuring out, like, are you a morning person, a mid-shift person? Are you a night owl? And then, like, seeing as much as possible if you can wake up naturally in the morning and, like, continue that over a weekend as well at the same time. With that, am I on the right track with those? Have I missed anything with that?
Yeah, I mean, everybody's different. I mean, the sleep hygiene, you're not supposed to drink caffeine after a certain time. I mean, caffeine doesn't keep me awake. So, I mean, I could be drinking espressos all night long. So
Yeah.
it's a series of suggestions, and some are appropriate for some people and some are not appropriate. And you just have to find whatever works for you. I think the other thing is, another important thing about is not going to bed until you feel tired. So lying there in bed when you know you're not going to go to sleep is counterproductive. So you should only be going to bed when you feel like you're going to sleep. And if you're feeling sleepy, then don't start playing with your phone and don't switch the TV on or whatever. But yeah, it's like everything, It's like, the cognitive behavioral therapy. Some people will do it religiously, one session every week. Some people will miss out sessions. Same with the light therapy. Some people will do it every single morning for exactly 30 minutes. Other people, might forget a few days here and there, or might do it for 20 minutes because they've got to go off. For lots of the patients, that they're just out of sync, and it's just trying to get them back into a sort of, inverted commas, normal rhythm. And you're right, some people are morning people, some people are night owls, and it's normal for them.
Right. So it's about taking these things and kind of experimenting a bit, kind of seeing what you might want to do and what might kind of speak to you or like fit in with your life. I did hear that difference between, just say during the week you're getting up really early and then at the weekend you're having massive sleep-ins. I can see Shauna's head going from side to side. Shauna, tell me, what is the effect of that?
Well, I think, and I suppose when you were talking about a different word for sleep hygiene, I like sleep routine, because at the end of the day, we need to build routine into our lives if we want an outcome on something. So I suppose you're completely negating that routine that you've built Monday to Friday, and you're kind of back to square one in a sense, because if you're a morning person and you're getting up at 7 a.m. Monday to Friday, and then suddenly you're sleeping until 10 or 11 a.m. By Sunday night, if you've woken up at 11 a.m. that morning, actually is your hunger for sleep going to be there the way it was there during the week? It's not. And you're probably not going to fall asleep as early. You're probably going to struggle to fall asleep on the Sunday night. Then you're going to wake up tired on the Monday morning. And it's just, you're just negating everything.
Okay, so on our circadian rhythms, it like sets them off. Andrew?
It's called social jet lag. So it's the same as normal jet lag, but it usually happens on a weekend when people, as Shauna said, they change their activities. Now, we all go out on a Friday night or a Saturday night, and well, not some of us because we're so old now, we don't go out at all. But it will affect people. I mean, some more than others. So it's just something to be aware of.
So, if someone was like, oh, I know, one day I'm waking up, there could be a 3-hour difference. Just even thinking about reducing that time, would that make, so within an hour, within 2 hours, would that start to ease the jet lag?
Yeah, I think it's about being pragmatic about things. I mean, people have to have a social life as well, or there's other things that happen, and so it's about being sensible. But I think if you follow the sleep hygiene rules Monday to Friday, and then you're out till 3 o'clock in the morning on a Friday night, and you're out till 3 o'clock in the morning on a Saturday night, you're going to expect to feel it on Sunday and Monday. And if that's what you want and that's acceptable, and and you can manage, then that's great. Yeah, I mean, with all of these things, it's the more of the intervention that you adopt, then probably the better the outcome. But we know from all of our studies that we suggest things, and maybe 80% of what we suggest actually happens. But there are other things people can do as well. So one of the things we haven't done in our study, but it's really important, is timing of eating as well. And this all goes back. Somebody talked about cavemen. I think it was you talked about cavemen. The bit about the light in the morning. Caveman lived in a cave. It was dark. You go out in the morning and the sun is there, and that tells you it's morning time. Caveman didn't go out in the middle of the night to hunt food and eat. They ate during the daytime. So our bodies are circadian rhythms are guided by light. So usually sunlight. That's the strongest factor in our body functions. But it's also affected by exercise. It's also affected by eating. So if you eat late at night, then that's going to have an impact, because your body will have to then start digesting the food, and that will affect your sleep rhythms.
So weirdly, I often think about kind of our cave people brains, especially late at night, because that idea of safety at night, as a tribe, you would have wanted some people to be awake so that they would be on lookout. I sometimes will put something on my phone that's just quiet chatting, and I think of it as people looking out, like literally like surveying and making sure that everything's safe. And that sound of that chatter just will lull me into a deeper sense of sleep. And kind of thinking in that way, then waking up to the sounds of bird song and light make a lot of sense why they can circumnavigate your logical brain, or maybe your rebellious brain, and behave on your kind of your nervous system to regulate it. Shauna, is that something that you've seen or that's come up in your work, that combining both the mental thing with the CBT, but with the light box is sort of tackling things on two different levels?
Yeah. So my mom and my brother, they can't sleep unless there's something on in the background, whereas that would be my absolute worst nightmare. So I think like that, it's so individualized.
Really
and even
is.
when we're giving out kind of sleep hygiene, or when people are going through the CBTI, I mean, people come back with very different things that they took from that, or even with the kind of the 4 sleep lessons from the CBTI. What one person loved, another person really didn't enjoy. So I think kind of exactly what Andrew said, it's kind of coming back to actually what suits you and what is acceptable for you. Like there was a couple of people on the study, you're not supposed to drink alcohol in X amount of numbers before bed. And there was 2 people on the study that was just an absolute no-go. That was the one thing that they looked forward to every single evening. And that's fine. That's right. What is acceptable to them. And then I think kind of answering your question in terms of, like the CBTI, the light therapy, the activity, they're kind of targeting us in different ways. And I suppose specifically in people with cancer, the causes of sleep, the precipitating, perpetuating factors, they're so complex. And I suppose that's why we felt that kind of a multimodal intervention, so more than one thing in it, would be important to improve sleep in a way that's meaningful.
Yeah, I really can see why those things together combined, and especially if you're taking a little bit of a pick and mix, but coming from different angles, would be especially helpful. And Andrew, you made a point about not being in bed unless you're sleeping after being, having a cancer diagnosis, is that thing of sometimes not being able to get up in the morning, and you end up spending all day in bed. And, there could be a number of reasons that you just feel you end up doing other things while you're in bed. You end up maybe working on your computer or watching TV or, doing other things, but you end up, having this very different relationship with your bed. Can you tell me, is that useful? Is that detrimental to sleep?
Yeah, it's detrimental. There's only two things you should be doing in bed. One is sleep in, and you can work out what the other thing is if you've got a partner. Well, you don't need to necessarily have a partner, but it's for intimacy, as Shauna likes to call it.
The fun bit.
I think lots of the people we see are very fatigued. What we would recommend, and we recommend this for inpatients as well, is physically get out of bed and sit in a chair at the bedside, or sit on the couch, or lie on the couch. Just not on the bed if you can. It's just the association of what the bed is for. The bed is for sleeping in. So you can lie on the couch, sit in a chair, relax, do whatever you need to do, but try
so it
to
can
do it
still
out
be
of bed.
in the same room.
Yeah.
So if there's a chair in your room, because for, some people might have roommates, or, the kids are in the other room or whatever, like there might be a reason that they kind of want to have a little space to themselves. But even within your bedroom, if you can fit another comfy chair, that would actually make a difference.
Yeah. And the other thing as well is, if you get, lots of the patients we see have naps, and that's okay during the daytime. But what you don't want to do is have prolonged naps in the afternoon, and certainly not in the evening. So, they're all little things, and you have to be practical about the things that you can do. And from day to day, there'll be days when people are really tired and maybe have more naps, and or they can't go out and do their walk around the park or whatever it is that they've decided. But it's just generally adopting rather these practices which can all help. I think the other thing I wanted to say, and I did mention it at the beginning, is it's really important for people to understand that sleeping tablets do not work. They should only be used emergency situations where people are really distressed by the lack of sleep, to just, if you like, break the cycle, and only for a day or two. The effects wear off very quickly. You develop tolerance to them, and they are associated with some really nasty long-term side effects. So that's why we've gone down the route of looking at non-drug interventions.
I'm personally kind of a relaxation geek. So I think there is something quite similar in the approach that you've taken with your study, in terms of having, multiple things to draw from in order to assist sleep coming in. And it's not that it needs to be done perfectly, but actually knowing what those things are can contribute incrementally towards a better night's sleep, which, like we were saying, can make everything feel better, can help even relationship with your partner, finding out which of the things work for you. And Shauna, coming to the exercise portion, was there something that really stood out that like people got the most sleep from doing? Or was it just any kind of movement?
I think what was really important about this study was, like, there's loads of studies out there that compare kind of various exercises, but I think it's really important to find something that somebody's actually going to engage with. So, we could ask everybody to make sure they do 2,000 steps a day or 5,000 steps a day and compare who done the most steps. But like, realistically, that's probably not going to work. I think that's the most important thing, is just finding something that the person actually enjoys. And it's not, 1,000 steps to somebody could be just as important as, 10,000 steps.
Absolutely. And I was thinking about it because exercise can be quite a connecting thing. Taking a walk might mean that you say hello to your neighbor. Mm-hmm. You're taking your dog out, or you're meeting other dogs, or you're noticing the scenery. I'm wondering if actually that little bit of exercise also eases the isolation.
Definitely,
and kind of coming back to that thing of, is it a sense of loneliness that sometimes, contributes to that waking up in the night? And there is nowhere more lonely than 3 a.m. in the morning, right? Like, it's so isolating. And if you're experiencing loss and grief, and fear, anything that can give a little bit of extra peace at that time. Do you have any tips for when someone wakes up in the night, or how they might frame that experience, Andrew?
I mean, I think the thing is to try and think about, is there a reason why you've woken up? Okay. And, you know, for instance, if you're waking up because of pain, then obviously, you know, take some painkiller, but, you know, maybe go back and see, you know, your GP or oncologist or whoever, and just say, look, you know, my pain's not under control. I think it depends on what time you wake up and how you're feeling. I mean, I think just lying there is not going to be productive. So I think if you don't go back to sleep quite quickly, I think probably to get up, it depends a bit on the time and the person. But, you know, just lying there trying to go back to sleep, you know, willing yourself to go back to sleep is usually not very productive.
They say the stress of not sleeping can make sleep harder. So trying to sleep kind of it's gonna escape you. A little bit like as I was falling asleep, I could almost touch it and then it went. So it's trying to find something calming to do at that time, or maybe going, it's okay, you know, that I'm awake right now, and maybe there's something I can do tomorrow to kind of set up my environment for more sleep tomorrow night.
And even the patients in the trial, you know, they will have bad nights, the odd bad night. It's about trying to make sure that those are, you know, the exception rather than the rule. And it's understanding what is normal. So that's a big part of the CBTI is, you know, there's lots of misconceptions that you have to sleep for 8 hours a day. And, you know, it's understanding that most people will wake up during their sleep in a normal night. It's normal for people to sleep much less than 8 hours, and some people sleep more than 8 hours. It's normal for some people to be very alert in the mornings, and others to be, you know, night owls. So it's just, we all have preconceptions, misconceptions about lots of things in life, and people have huge misconceptions about sleep. And often it's just like, you know, you're relatively normal. Okay.
Ooh.
Or you are
Nice to hear.
Yeah, you know, we just need to tweak a few things and get you back to being normal. And I think, you know, going back to what Shauna was saying about the exercise, they don't need to be going down the gym. What's a lot of the patients have said is, okay, they've started to walk a bit more, and they've recorded, you know, how many steps they've had, and they feel good because they've done a bit more. And so the next day they try and do a little bit more. And as you say, you know, they're getting out, they're engaging with people. The exercise, as well as helping with the sleep, is helping with their general fitness, and they can see a positive side to the exercise, as well as just helping with their sleep. And we've seen big improvements in general well-being with relatively small improvements in the actual amount of activity people do. So, you know, you don't need to go from just, you know, walking around your house to, you know, walking 5 miles every day. Just very small incremental increases can have huge physical and psychological effects on people.
So if someone is listening to this, they're like, oh my God, I have not slept in, could be years, you know, because it can become such a chronic state. What's the one thing that they can do for tonight, Shauna?
Do I have to pick one?
Well, you can sneak in.
I mean, I think probably if I can even pick two, the waking up at the same time every day is probably one of the, if not the most important thing. And as Andrew said, it's kind of short-term pain, long-term gain.
Okay.
Especially, you know, like a lion is every now and again is not going to do us, you know, do us in, but especially if somebody is really, really struggling with sleep, it's really important. And then I suppose that thing of not going to bed until you feel sleepy. And I know Andrew's heard me say this a million times, but I follow Matt Walker. So he's an expert in sleep. He's actually from the UK, and it just really resonated with me from his book. It's a really nice way of explaining things, that you don't wait at a dinner table and wait to get hungry. Like, you don't sit there and wait to get hungry. You go and you have your dinner when you're hungry, usually. And it's the same concept of sleep. If you go into bed and you're not sleepy, you're going to be fighting with yourself and you're not going to get to sleep and you're just going to end up in worse form. So I think if I could pick just two, they're probably my big ones.
Oh, I love that. And like really doable, right? Like,
yeah.
Yeah, lovely. Andrew.
Okay, I agree with what Shauna said. What I would say is when you wake up tomorrow morning, presumably it's going to be dark, you put the lights on. As soon as you get up, you put the lights on, because what the light does is it stimulates the back of your eye, and that sends impulses to your brain to say it's morning time. And that sets off a cascade of changes within your body. So yeah, switch the lights on.
Okay. And
right.
So that
just normal lights.
Normal lights.
Yeah. And if it was summertime, which it clearly isn't, you throw open the curtains.
Yeah.
Because sunlight is the best. Normal lights are not as good as the bright lights that we're using, but they're better than nothing.
Brilliant. And as a last thing, it would be amazing to find out what light box were you using, and like if someone's interested, where do they get one? Like what's the scoop on light boxes?
Go to Boots.
Yeah
Excellent.
Or any other high street chemists.
Yeah. And are they expensive? Are they like, they're pretty?
You can spend anything from €15 to hundreds, and in some cases thousands. The most important thing is that, so lux is how we measure light intensity. So in order for a light box to kind of have an effect on our circadian rhythm, it has to be at a strength of 10,000 lux.
Thank you. I feel like we've covered so much today. The takeaways are that it's okay to prioritize your sleep, that it's something to bring up to address those foundational things that are causing the lack of sleep, and then looking at other ways to create the right environment for sleeping, and staying out of bed as much as possible when you're not actually just about to go to sleep. Or you're going to have some fun in bed. And I'm going to get one of those light boxes. I'm doing it. Really, really lovely to have you on today. Thank you to all of you listening. Thank you to Radio Facilities for sponsoring our podcast. And if you are struggling with your sleep and you're thinking, I want to talk to other people so that I know I'm not alone, even when it's 3 a.m. and it feels really lonely, I want to know that I'm not alone with that. Come along to Shine. Check out the website, shinecancersupport.org, and see if that extra connection of feeling less alone does something to stop those micro awakenings. So that's all for today. Bye. Bye.